right, good morning all. Healthy, wealthy, and wise 2020. What a year we've had. But good news, we're back again. So glad that everyone is able to join us. We have a wonderful panel and upcoming discussion. It's going to be terrific. We have a couple of people and a couple of things we want to point out to you. Let's begin by introducing Vicki Montgomery. Tell us, Vicki, where you're from and your role.
Thanks for joining us. My name's Vicki Montgomery. I am the Director of Marketing with Storshine Law Group, and I will be your virtual host today, kind of the person behind the screen. And, well, thanks for joining us.
Thanks, Vicki, for being here and for all your work. And Mike Cooper.
Good morning, everyone. Healthy, wealthy, and wise. I'm Mike Cooper, co-owner of Naperville Senior Center Adult Day Services up in the corner of Ogden and Naper. And I'll be the moderator here. Looking forward to questions and make sure that the correct panelist gets the question. And hope you have lots of questions. We should have a lot of good information. And I look forward to the program. Thank you for being here.
So many of you that are familiar with Zoom, you know you have a chat button where you can put in a question or a comment. Mike will be monitoring those along with the panelists, and we'll try and get to all of the questions. So that will be a help, I think, to all of us. So we're gonna get going. So let's put our panelists up and let's get started. Hey, I want to start it off. I've got an impersonation for you that I want to take you through. See if you recognize this person. This button here, this is the button. You sure? You know, it'd be easier if you just did this for me. Oh, I know, I gotta learn. All right, push this button. Yeah, something happened. Oh, look, the screen went dark. Hello, anybody in there? No, it just went dark. What do I do? All right, I'll push it again. There it is. Well, now it looks like the TV set with my picture in it, and I've seen this guy this morning. Anybody recognize that person?
It's my dad.
That was all of us, huh? At some point with the Zoom and all that's going on. So I think we've come a long way as a group, and excited to have everyone here. All part of our future. Our topics today and our agenda and our panelists are all just wonderful. And want to remind you, where do we get the ideas for our programming? Well, they come from you. And so this year, we're going to ask your feedback. Again, we're going to send out a evaluation document and a survey on topics that you would like to see. It'll follow the conclusion of the program by email. We sincerely ask you to fill that out. In your evaluation, be kind, but real. So we really appreciate your help on that. When we talk about the sponsors for today, I want you to realize that Triad is an organization that's been serving our community for 10 years, dedicated to the support, the education, and the engagement of seniors in our community. Our volunteer group is made up of our 3 partners: law enforcement, senior service providers, and of course, ourselves as seniors. Very excited about the work that they've done. Our partner for Healthy, Wealthy, and Wise, again, this is our 7th year partnering with the city of Naperville to bring this program out to the public. We're excited about working with them as always. They've done so much to support the senior community. We're going to hear from Jim Hill with the Naperville Senior Task Force coming up towards the end of the program, and we're excited to have them with us. As a partner, as always. What a team they have at the city. It's so easy to work with. So our agenda will be split into 3 different parts following our open segment on senior health. We're going to move into a short break. We have some exciting announcements from Naperville Senior Task Force as well as the Triad about some upcoming things and things that are happening in Naperville. And that will be followed by the raffle. We have a number of wonderful raffle gifts to pass out. So let us begin. Senior Health 2020. a clear vision for moving ahead. You know, the hardest part of this year is really getting a focus on where we should be going. What can we do? And I think that is a challenge for all of us. And it begins by understanding that health is really whole person wellness. It's not isolated. This is mind, body, and spirit. And we must consider nurturing all three parts. And I wanted to talk today, in the beginning, Dr. Penny, what are the greatest challenges that you see now facing our senior community? And what are some of the keys for us to move forward? And, you know, my business training says you're not moving forward, then you're falling behind. So none of us like that. So where do we begin?
That's an excellent question. So I wanted to start in just saying thank you for having me out here as a panelist, and thank you to everyone who is participating today and listening. A big piece of that response is honoring your journey and where it is now. And being present, informing yourself, that's a good way to be able to know on how you can better respond when you're feeling maybe a little more anxious or stressed. Some of the things that I've been experiencing within just my office doors, there's a lot more stress that's being increased by not being able to see family members or going out to favorite restaurants, going to different services for church. There's also more fear in regards to not having this have been completed by that first deadline in June, and this was supposed to be over in June is what I often have heard. But we can honor our journey and where we're at now, making space for creating new opportunities. So where a lot of times in the business world, it's don't reinvent the wheel. This is one of those where we can reinvent our wheel, or reinventing the wheel of what a typical lunch gathering could look like. Whether it's something where you can join your friends on Zoom with a meal in front of you, or even just listening to a show, pausing when the commercials come on and kind of dialoguing in between. There's ways that we can maintain that connection and still feel that we have that control within our lives.
Wonderful. Thank you for that. And, you know, it's being a tough time on challenge, no rule book. It's really hard to find your way and move through that. At the same time, we know that protect our minds. It also requires us to pay attention to our physical abilities. And Dr. Phillip, I wanted to ask you basically the same question. What are you seeing now where we are with your seniors, and what are some of the things you're looking forward to lead us in a direction to better health and happiness?
Yeah, absolutely. I mean, great question, Brian. And first of all, it's just an incredible privilege to be here with you guys, to be able to communicate, again, what we're seeing on the ground, you know, with our patients, and some things that could be helpful. Just a quick background on me. I'm a physician with DuPage Medical Group. I work in something we call our breakthrough care centers, which is our patients who have more medical conditions. And so we find that about 5% of patients account for 50% of all healthcare costs. But generally in the healthcare system, they're treated like everyone else. So we created these centers to try to address people's mind, body, soul, and spirit with a team of resources, social workers, pharmacists, nurses, health coaches, and physicians, of course. And so we see the real kind of mental health, physical health, and spiritual health problems that people go through, really, every day, especially during this time. One of the things we're seeing is that the more, and there have been studies that have shown this, that the more people watch the news, the more people get more anxious and depressed. And the news actually really kind of feeds that. See the similar thing with social media, and there have been multiple studies that show that too. And I think part of the thing is that it's really hard to actually look at the data and actually get an unbiased approach. It just seems like there's, especially potentially with this political season, that everyone is trying to sell something, and I love this opportunity to just actually say, okay, let's look at the data, let's take a step back and see, okay, how are we hurting ourselves, and how can we bring kind of back to balance. And so one of the things we recommend is actually just, watching less news and giving people resources to look at the data themselves. So there are actually some great resources that people can use, one of which is if you go on your search engine, such as Google, and you look at COVID tracking project, you can look at the daily number of cases that are there per state, the hospitalizations, the mortality rates, and you can actually look at the trends yourself. And another resource is the Financial Times, and just type in Financial Times COVID data or COVID charts. And you can look at your state, again, the cases per million. And when we look at that, we see that in Illinois, for instance, there's about 1 in 10,000 people get coronavirus, or 1.5 in 10,000 people get coronavirus every day. And so the actual risks are kind of different than they're potentially being presented. But also, and even more importantly, is that the mortality rate has been decreasing steadily. It's come down from 0.3 to 4.4% in June to now about 0.1%. And it's actually rare for us to see people dying of coronavirus in the kind of the DuPage County, partly because of testing advances, treatment advances, and a better understanding of how to meet our patients early and intervene early, so that we can prevent some of those bad outcomes. And so there's actually a lot of good news. That doesn't mean that we can, we don't have to focus on prevention. Of course, that's very important. Masks, hand washing, social distancing are important. But the other part of that equation is there have been multiple studies that have shown that being socially isolated increases premature mortality. For instance, there was a large study when we look at 300,000 patients, and they found that people who are isolated had a 50% increased risk of premature death. And so that was more than obesity, more than physical inactivity, and was actually the equivalent of smoking 15 cigarettes per day. And so I think we need to understand what are the real risks that we have, and how do we address those risks? How do we still interact? How do we still engage, maintain our wellness in a safe, healthy way?
Thank you, Dr. Phillip. Wow, powerful stuff, and so much tied into that. And yet, as you talked about the connection of mind, body, and spirit, you need all three.
Absolutely.
You need all three going forward, and for those who struggle in any part of this, you need to help nurture all of those. And so, Reverend Fair, tell us where, it's been tough for churches, right? I mean, this is not been easy for congregations or churches or faith-based groups. And where are we, do you think, today? And what do you see as our move forward?
Well, thank you so much for having me. I'm Verna Fair. I'm the rector of St. John's Episcopal Church here in Naperville, and I've been the pastor there for almost 14 years, and I've been in ministry for almost 40 years and had a variety of settings, rural, urban. I was a military chaplain, a campus minister, so I've had an opportunity to experience ministry in a variety of places. So I'm happy to be able to be in Naperville and to share with you this morning. Our faith really comes into play right now in this crisis. And I like to use the analogy of a well. For many of us, we have stored in our well knowledge, experience, wisdom, scripture. We've consulted our holy text. We have placed in that well a variety of strengths and words of encouragement. And so now in this difficult and challenging time, we can go into that well and draw out of it those words of encouragement, the opportunity to come to God in prayer and to read our holy text, our scriptures, and really find a source of strength and be able to communicate that to others in our family and in our community. And many of the things that we're applying now to help us with social distancing and mask wearing and hygiene. Those are age-old ways of maintaining our health and well-being. And then we see that in the scripture. We see that when people were ill or had sicknesses, they were separated out, and that in order to enter back into the community, they were examined to make sure that they were not contagious. So these methods that we're employing now are age old, and they have worked. And so we are able to look in our scripture and see examples of how people of faith have endured long and difficult times. And one of the advantages that seniors have is that they have had many years of going through all kinds of challenges and facing all kinds of trials, and have developed resources in order to get through those challenging times. And they can share that with others, with members of their family and their community. And you're so right, Brian, that church and our faith group, it's been a source of strength for us, whether it be our mosque or synagogues. It's a place where we are able to gather. And the challenge we're facing now is that we can't physically, in many places, gather. And so how do we maintain that faith connection? Well, churches have been very creative in ways of doing that. And many of us have been able to experience our worship life and the source of that strength that we so enjoy by going online. The church has been agile and flexible and been able to create an environment where our community connections can be maintained. And so that's an exciting way that we can continue to build our faith and strengthen our confidence. I like to really encourage people to spend time in prayer, and we have lots of time for that now. And consulting our holy texts and finding those words and confidence to know that God is with us and that we are able to get through this, and have a mindset that is positive and encouraging, and know that we are not alone, but we have faith strength, we have divine assistance, and we have the strength of our community, that we can come together and be sources of encouragement for each other.
Yeah, we're not alone. And you know, that's the key thing, all of us. And we're going to take on some of the things of isolation and developments and how to approach that. But I hear a lot of our senior group and people that I'm in contact, they talk about being afraid, talk about fear. It's unknown. I don't really know. Should I go out? You know, they say they're open, then they're closed. I'm in Will County, so you know what I'm talking about. They're open, they're closed. I'm just caught in the middle. How do we take this on? What are the ways that we address this? You look like you're ready.
A lot of this is being able to know what's within your control. Being able to know that, well, you can't control what other people do. You can be in control of what you do. So if you decide to go out and, you know, go to the stores or take a walk in the park, knowing that you can carry, you know, having your mask on hand, having hand sanitizer, tissues, things that you can use to maintain what's within your own personal environment. In addition to that, the fear is our common response that we have when there are things that are unknown, right? That stress response begins to go off. Sometimes we might feel like our heart racing, maybe our hands might be a little bit clammy or sweatier. Maybe we're feeling more tension and soreness in our shoulders. Those are our key indicators that something might be going on and we might be responding to something within our environment. And so here right now, I want everyone, even panelists and all, let's just take a nice, quick, deep breath in. And slowly out. And let's do that one more time. In. And slowly out. Your breath is available for you to be able to help reduce some of those physiological responses that might be going on.
That's wonderful.
You
Dr.
know,
Phillip,
we have such a wonderful opportunity as faith-filled people to draw on the reality of God's presence with us in the midst of the trial and turmoil. And I find that often in the scripture, the word that is given to people when they are afraid is do not fear. And the remedy for fear is faith. To go into the well of faith and draw out words of encouragement in scriptures. I think of Psalm 91 that talks about God being with us and that how we are blessed and that the presence of God will strengthen us in difficult times. Or Psalm 103 that talks about God's desire for health and healing and imparting wisdom to the doctors and nurses and those who are working to assist in our healing. So we have our faith to draw on to combat fear when it starts to build in our hearts.
Dr. Phillip, it's not March. We've come a long way in understanding things to do, and I've heard you speak on this many times, and that we're in a much better position than we were then. And can you talk a little bit about that? And I know so many of us get confused between COVID-19 and the regular flu, and you know, what are the ways that we can? What do we know now that we didn't back then when most of us were afraid? Let's be honest, we didn't.
Yeah, Brian, and there's been a lot, and I just to add to what Reverend Frere just said, there are also many medical studies that have shown that faith also improves quality of life and also quantity of life. That people live longer and their sense of well-being improves too. So I think sometimes people look at science as contradictory to faith, and it's not the case. I mean, they really align. You just have to look for it. In terms of, and same thing with the coronavirus, is I think we want to look at the data and actually just follow what does the data say without any kind of pre-existing agendas or biases. And you know, DuPage Medical Group was open in March and April, and my clinic, we had to make the decision as a group: do we shut down as other healthcare agencies, including Cleveland Clinic and some of these large healthcare agencies were shutting down, or do we stay open? And we made the decision to stay open because we were like, people have other things happen to them other than coronavirus. And we saw a lot of people with blood clots or cancer diagnosis or congestive heart failure that wouldn't have been diagnosed. But thankfully, none of our staff has gotten coronavirus. None of our patients have come into the clinic and gotten coronavirus because some of the preventative steps that we've taken and taking it seriously. But I saw the difference, in March and April. There was a lot of misconceptions, even in the medical community. We were looking at bits and pieces of data that we had from China about what they were doing. And we to be frank, didn't know what the best ways of treating coronavirus was because of limited information. At the time, it was common to think that steroids were a bad thing. We now know prevent mortality by about 33%. We didn't know that blood thinners can prevent 40% of people who can have blood clots. And that was a lot of the side effects that people were having. And when we look at the number of cases that were happening in March and April, we had that second wave in June and July. And it was about the same number of cases per day of coronavirus when you account for testing differences, access to testing, about the same number of hospitalizations that you had in March and April versus June and July, peaking per day. But we had 40% less mortality in that second wave. And what we've seen is that decrease in mortality has continued to improve over time. And if you look now, like in Illinois, for instance, there's about 20 people that die every day in the whole state of Illinois from coronavirus. But if we look back 4 or 5 weeks when those cases were first diagnosed, there are about 2,000 or so people who were diagnosed at the time. So that's 0.1%. And that doesn't even account for all of the people who are asymptomatic who don't even qualify for testing. And so we've really come a long way, and we're going to have a few more breakthroughs on the horizon, one of which is cheaper point of care testing that has already started to come out. Abbott Labs has come out with the Binax Now, which is a 15-minute point of care test that's like a home pregnancy test where you do a nose swab and get the results. The federal government has bought up 150 million of those to potentially help deploy in nursing homes and some high risk environments, but there are many other companies that are coming out with that. And in the next month, I would anticipate, a big opening in terms of testing, both for our schools and employers and employees and things of that nature. I know DuPage Medical Group has had dramatic increases in testing, as others have potentially decreased testing. But there's also treatments. There's some technology that's coming out potentially, and their trials should end in the next couple months, where they look at artificial neutralizing antibodies, basically antibodies that bind very, very well to the virus and take it out of your system. That technology has been proven, and even in difficult viruses like Ebola, where there's such a high mortality rate, to have a 50% decrease in mortality rate. Preliminary research looks really good, and that's going to help prevent morbidity as well as mortality, and of course, vaccine development. So there's a reason for optimism, but again, we can't get overconfident. We still have to do the simple things of prevention, like masks, hand washing, social distancing, avoiding high risk environments like indoor dining, and I think there's a reason for encouragement.
Yeah, absolutely. Could you give a layman a better understanding of what the COVID-19 and that virus versus the flu is really like? And by the way, I hear good reports about the flu season. What do you say about that? About flu shots, things of that nature that all of us have to make a decision on.
Absolutely. So, the flu vaccine has been shown to decrease mortality. I think people kind of underestimate the flu a little bit here, in terms of there's been studies showing that getting the flu actually increases heart attack and stroke risk down the line by increasing inflammation. Of course, some people die of the flu too because it causes pneumonia. COVID-19 is more dangerous than the flu, so I don't want to, be unclear about that. It increases inflammation, heart inflammation, just like the flu can, but it does more so. And so, but the symptoms of the flu and coronavirus are so similar that clinically you can't tell the difference, because different people can have a variety of different symptoms. So I've had people with emphysema on oxygen get coronavirus, and it looked like a simple cold. It can look like that, even with people with severe underlying medical conditions. And so that's why testing is so important. If you have symptoms, even cold symptoms, call your doctor, just get tested. It's a simple test. It just goes in the front of the nose. You can go through your car, kind of drive through testing. Best way of testing. And that one swab, you can test for the flu, for common cold, and coronavirus all at the same time. So then you can find the root cause of what's going on and prevent it. Getting the flu shot is really important this year more than any, because if you have flu-like symptoms and are weak, that can potentially make you more vulnerable to getting coronavirus or some of those worse side effects. Thankfully, Brian, as you mentioned it or alluded to, is the flu has reached record low levels in the Southern Hemisphere, where they're just coming out of their flu season. And so again, in the media, there's a lot of doom and gloom and dire projections about the flu season and how it could be this disaster. Well, what we're seeing is that actually wearing a mask, hand washing, and being kind of smart, that also prevents the flu. And so we're seeing record low flu all across the world in people who just had their flu season. And we have no reason to expect that won't happen to us as well, as long as we're doing the simple, consistent things, getting your flu shot, being smart and wise in terms of preventative health, and following medical advice.
And I think even adding on to that, even the things that are still within our control of regulating our making sure that we're following good sleep hygiene, eating well-balanced meals, seeking mental health treatment if we need it. We've also been open since the pandemic. Well, we've been open since, a while, and it's AmeriCare, but more so at the pandemic, we had our doors open for on-site and telehealth services. And what we found was individuals who wanted to kind of grasp that, how do I deal with the stress that is going to be going on? The key pieces of maintaining good sleep and integrating, your spirituality within your healing, and making sure that you're eating good meals, following the directions of your doctor. All of those ways are wonderful ways that we can help prevent and increase our immunity. The other thought that I was going to add with that is a lot of times with the mind-body connections, we don't realize on how the stress actually impacts our long-term body response. So we have sometimes when we have chronic stress in our lives, it can contribute to heart disease. It can contribute to diabetes. It can contribute to cancer. And so finding ways to reduce our stress response that we are experiencing can be ways to not just help us during the coronavirus pandemic, but also long-term in our life.
Yeah, I want to come back to that briefly, but one of the things that stands out in our discussion so far and going forward is we own these things.
Mm-hmm.
Our health, our nutrition, our understanding, our prayer, our lives, we own them. And right away, this is about us that can make a fair plan, can lay out a path going forward. And I think that's important. I've heard so many people say, I can't wait till we get back to normal. We've all heard that. Okay. But there's a journey here, and you own it, and you can thrive. And that's important. And I know that so many are concerned about our churches and the faith base, and when will we get back to full attendance and being back to that? And I don't know. Is there an update, Reverend Fair, on when the churches will reopen?
Well, I think every church is seeking to practice those kinds of activities that are healthy and are for the well-being of the people in the community. Mm-hmm. And based upon what's happening in our local communities, churches are determining whether or not they can move into in-person worship and to what extent and how large the gatherings can be. For many churches, it depends on whether or not the positivity rate has gone up in their community. We were preparing for in-person worship to start at St. John's Episcopal last week, and then we got the word that from our diocese that the warning had been given to DuPage County that the positivity rate was going up, and that we needed to we could have an outdoor service, again maintaining all those important methods of mask wearing and using social distancing, but that the in-person worship inside our church building should probably be held off for a little longer. So I think each church is evaluating their community, what the needs are. And of course, many churches have those who are in the vulnerable group. But I have found that many of those in the vulnerable group, because they have lived through so much, they are concerned, but they are really hopeful and desirous to getting back to being in the presence of their church community and their friends. And we've prepared our church. We have all of the social distancing signage and seating and all those things that are necessary, mask wearing. So we're hopeful that we can get back together in the physical space. But until then, we still have to use the methods that are available to us, our Zoom services, our Facebook services. We have a method now of calling all of our parishioners. We've divided up our parish list. And so in a sense, there has been many positive effects, side effects that have come from this pandemic, and that in terms of relationship building, really seeing and communicating with each other, practicing certainly better hygiene, but also practicing our faith at a deeper level and being able to find those things in our lives that bring us joy and peace. Many people have found new hobbies in this time. Many people have found new ways of providing service and caring for other people, either mask making or making phone calls or contributing to the community in ways that provide food to those places that are in need of food. So in the midst of this pandemic and the struggles that we have experienced, we have found new pathways of really caring for each other and providing that strength to our community. And the senior community is so great about doing that.
You know, they really are. And I think that we were talking earlier before we came online about there are some stressors out there now that we need to start talking about removing. And Dr. Phil, we were talking about the influence of external media and sources when we were on earlier. Talk about that and what you see.
Yes, I mean, I'm pretty apolitical, and so I'm not advocating for one party or another. What I see really from both in this election season is that either people want to make it sound like nothing is happening, or they want to make it sound like a meteor is about to hit the Earth,
Mm-hmm.
and die. And the reality is neither of those things is true. And so basically, we just want to kind of a balanced approach. I think balance is very important, is having a realistic understanding based on the data that we're seeing. There is a risk, but the risk is actually pretty small, in terms of 1 in 10,000 people getting it per day in Illinois. Actually, even a little bit less than that in DuPage County. But it's real risk. And so when we look at comparisons, so for instance, in New York City, the risk is about 1 in 25,000 per day over the last 3 months. They had such a bad first wave that they took really seriously their preventative efforts. But when you compare New York City to Madrid, Spain, they had a similar bad first wave, but then now they have a terrible second wave because they kind of took their foot off the gas. They got overconfident. You see a similar thing happen in Israel, where their cases went down to as low as 2 per million. So only 2 cases per million per day. And now that's up to 400 cases per million, and they need a second lockdown. And so, Brian, to your point is, we actually have so much in our control. I know it feels like there are things out of our control. There are always things out of our control. Focusing on the things that are in our control and working together as a team with the faith community, with mental health community, with your medical community, and to create like a plan and a strategy. So, for instance, my father has cancer, and 4 or plus years ago, he was given 6 months to live, and he's been with us for those more than 4 years. And it was because of thinking about that mind, body, and spirit, and all 3 made such a big difference for him. But in this time of coronavirus, we're really careful with how do we isolate, just isolation and not seeing anyone. That's not good for his health either. And safe ways of seeing the grandkids outside, socially distanced, in safe ways. It's extremely unlikely to get it with outdoor ventilation and things like that, especially with mask wearing and hand hygiene, and just understanding there are safe ways of interacting with our loved ones and our community, and how do we practice that?
Well, it's essential to our health. We were going to talk about it, and one of the statements that I like to say is that senior health, our health, is more important now than ever before. And the comment to that is who has the experience? Who's been through the world wars? Who's been through all of these things? We're needed. And, if you find yourself isolated, and I know there's a lot of addictive things that can take us over, and anything can be that to extreme, right? But, the world needs us, and our families need us. And as, when I used to whine about never getting any phone calls except salespeople, I remember my mother looking at me and saying, "You want to call, make a call." And that's good advice. You want a letter, write a letter. You want to stay in touch with somebody, you go ahead and reach out, because we've been here before as a different cohorts as seniors. So I'm excited about that. We talked about some of the ways that people are connecting in creative ways that, people are overcoming fear and isolation, which is such a killer. And Dr. Penny, you mentioned the breathing and socialization, other ideas that we could begin to perform or take on or incorporate into that plan that Dr. Phillip talked about. Without a plan, it's very hard to know where you are. You can't measure, you can't see it. And
good question. So when we feel that physiological response, our breath could be an excellent grounding technique that we can use to kind of bring us right back to the present moment experience. Other grounding techniques can be just listening for 30 seconds, seeing different things within your environment, 5 different things that you see, 5 different things that you might be able to touch around you, or things like that to kind of ground you back into the present moment. Oftentimes when our anxiety, stress kicks in, we might be thinking, and then our thinking begins to spiral. And before we know it, we've gone from, I want to go to the store to, but I can't because, there's 100 people with coronavirus in there, which is just our mind's way of trying to kind of keep us protected. But when we know that that's not the reality of it, that we have a lot within our control, that we can reduce our risk of infection, other things that we can do to kind of help. So that's number one, is grounding ourselves to the present moment experience, engaging in more of these self-care activities, whether it be exercise, walking, engaging in mental exercise of meditation. There's some wonderful, even if you don't have access to or being able to see a therapist at this time, there are some YouTube videos that you can watch with body scan meditations or leaves on a stream, just to name a few. But those things can be really helpful to help us reconnect to the here and now. When we're not in the here and now is when we begin to think back to things in the past or in the future, which is good to have that plan, but we're not focused on the journey that we're on right now. So other things to do: painting, writing, listening to music, watching, nostalgic TV shows, or listening to nostalgic music. All of those things can be ways that we can reconnect with ourselves and the people that we love.
Oh, absolutely. What comes to mind is music and laughter for me. And, one of the things that we've also done is kind of a little bit of self-isolation through the fear that we can't go to the store, we can't do this. Should we put off our medical procedures or exams or tests that we were scheduled for? And now, Dr. Phillip, where are we on that? I think we're in a much better position for us to be able to pursue the things we need for our better health than we were before.
Yeah, absolutely. It's something that we do at DuPage Medical Group is we track what happens to our patients. And I told you, none of our patients who've come into our clinic have gotten coronavirus. None of our staff have gotten it at our site. And we look at that and we really take those things very seriously. And so we realize the risk is extremely low. But the risk of not getting tests are real. I mentioned earlier that we found people who have had cancer, clots or other things, because they have the courage to get the test, and then catching it early, we were able to treat it early and spreading. And so there's a reason why these preventative tests are done. I think this is a good conversation with your doctor that, if something is, not urgent, it's reasonable to delay things, a little bit, but for the most part, it's pretty safe to get your preventative screens because there's a reason why you're getting those screens. And so that would be my focus. I think what's fueling some of this fear is some of the early reports, for instance, in Wuhan, China, where 30% of the cases, people going to the hospital, getting admitted to the hospital and getting coronavirus from other coronavirus patients. We saw some of that in New York City when there were the huge outbreak. But that there's a very big difference between being admitted in the hospital in the midst of the first wave outbreak to getting routine tests right now. And so at this point, the risk would be extremely low to getting kind of routine testing versus, the initial fears that were there.
And Dr. Phillip, I'd like to even add, a lot of the facilities that are currently seeing patients are deep cleaning and sterilizing the sanitation. Even within my office, before someone new enters, I will Lysol in the areas. I will use my wipes to clean doorknobs. Things to kind of maintain some of that sense of safety for our health, but also for the people that we serve. And so there are preventative measures that are being taken at all of many of the doctors' offices within the area. And so each one varies on what they're doing differently. Temperature checks or, hand washing, sanitizing, maybe having one person in the office and if they had somebody wait for them in the car. But there's definitely things that are being put in place so that way we can help reduce the levels of infection.
I think also to add to what you all have said, fear is real. It's something that is a natural human response and it can be a help when we get that gut level reaction that says, uh-oh, I might need to stop what I'm doing. But also fear can be managed. Sometimes, often in life, we have to do it afraid. And, that's wisdom in there as well. We have fear about what we're doing, but we do what is wise and we go forward in spite of the fear. And we can manage the fear. We have tools that we can use to help us. The doctor, Dr. Phillip has also indicated that, and Dr. Penney indicated that we can do things to offset the power that fear has through health activities, through mental activities, and through our faith and prayer activities. But there are many times we have to go out, and we may still feel afraid, but we put in place all those things that we can to stay safe and protect ourselves, and we go out and do the things we need to do. And so I think that it's important to recognize that fear is real, it's going to be there, it can be managed, and it doesn't have to control us. So many times the scripture says, fear not, for I am with you. Mm-hmm. And so we can have that comfort knowing that we're not alone, that God is with us, even in our fear.
Yeah, that's a wonderful point. A question came over the line, and well, where do we stand on seniors getting back to their gym and their Silver Sneakers programs? And any thoughts about that, Dr. Phillip?
Yeah, I think what we got to look at is it's very gym specific in terms of what are those preventative steps that you're taking. Are people wearing masks? We know the way I think about it is what is the absolute risk and what is the relative risk reduction. Mm-hmm. And some activities that have higher risk. For instance, the CDC showed recently with a report that there's 50% increase risk when they looked at people who did get coronavirus. There was 50% higher risk of indoor dining in restaurants. And that was a way that things were spread because you have to take your mask off and you can hang in the air for a while and things of that nature. Gyms, do have an increased risk if it's poorly ventilated. Okay, people are breathing heavily in and out, and so you can get a lot of virus hanging in the air. So if you have a mask protocol where everyone is required to wear a mask, that decreases the risk by about 80%. If some gyms have outdoor bikes and stationary bikes outside where you can do that, or outdoor aerobics and things like that, again, when you're outside, the ventilation dramatically decreases the risk to almost zero. And so being thoughtful with what are the situations you're putting yourself, not all gyms are the same in how they approach that.
Yeah, I think that is good advice. And I know all of us are kind of thinking ahead to winter. We have holidays, we have winter. Hopefully spring will come, but not soon enough for some. And we have to take that on. And I think we've had some really good suggestions. But any last thoughts as our time is closing about facing the winter and the holidays and some of the keys?
I would say especially reach out to your faith community, to your family and your friends. Choose connection over isolation. And to help with the physical activity, there's an opportunity for us to go online and participate in Zoom exercises and yoga and different kinds of activities that bring us into communal activities with other people. And so I would really encourage people to stay connected, especially in the winter. Find your spiritual center and draw from that. Stay connected to your faith community and your family. Make calls, write letters. Find that inner strength and allow it to blossom in this time.
Absolutely. And remember, your family needs you. The stories of your childhood and those things, those are wonderful to contribute and bring everyone closer together. Any other thoughts about the winter And the risk, we've had some wonderful things here that we really have a lot of control over how we face these coming months. And I think we all expect good news to the end of the virus. I don't know if any of you panelists have a crystal ball or when you think this would disappear, but looking ahead to the winter, any other thoughts?
Yeah, yeah.
Go ahead.
Oh, yeah, just a quick thing, as I would say, is that just as we've seen the risk steadily decreasing because of testing, treatments, and prevention, we're also going to see vaccines rolling out, in the next couple months or so. And then as people get that, those risks are steadily going to decrease. So we are aware that in the fall and winter, that viruses do transmit easier, just like the flu, that it is harder to get in, outdoor spaces. But this is where creativity comes in, where, you can sit in your car and have the window down and, talk to the grandkids through that, or come up with just kind of creative ways of maintaining those interactions. But also understand that as more people get vaccines, that in the months to come, that those risks are steadily going to be decreasing as there are more treatments, steadily decreasing. And so it's going to take some creativity. And I love your point, Brian, of just making a plan now so that we can stay engaged, as Reverend Fair said, with our communities, with our loved ones, with our families, and working with your team, work with your health team, work with your spiritual family, work with your mental health providers. And you're not alone. You don't have to do this alone, I guess would be my takeaway.
Yes, that's the truth. Any other thoughts on that? I know Reverend Fair. I've got a couple people online that ask from a spiritual sense that, is this some type of punishment or an attack? And I put it out there because I've heard it more than once. And you can read it online as well. Would you help us help us respond to those who feel that this might be punishment or an attack?
Well, I think it's important to sort of look at your faith texts to kind of see in those texts how God works with the human community. And from the Christian perspective, the dominant theme often in Christian scriptures is love. That God loves and cares for people and goes out of his way to provide an opportunity for people to be healthy and well and to have community. And so I think it's important to keep our worldview and our faith view not from a standpoint of punishment or a curse, but from the standpoint of God's love and grace, that God is in the healing business. So God supports mental health and physical health and have given us doctors and mental health professionals to heal us and keep us well. So I think if there's a mind shift from the angry God who wants to punish to the God who is loving and caring and providing resources and strength in the time of crisis, would help us to approach this from a standpoint that will be strengthening rather than debilitating.
Oh, I think that's it.
Follow
Go
up
ahead,
with
Dr. Penny.
points on, well, in addition to that point, and then also on the point about final thoughts on what we can do. Oftentimes we think our faith experience is just completely one straight shot up. The thing with our faith experience, it's a journey, just like our life, it's a journey. So oftentimes we're going to go up and then we might have this dip, and then again, we're going to go up and then another dip. Where we have those dips, that is where our growth happens. That's where we have difficulties that we might be experiencing, and it's honoring our journey, that this difficulty, although it's difficult, it's brought and it can bring on new and great opportunities. Thinking about COVID, there's been a lot of negativity with it, but there's also been a lot of positivity that's come with it. People have connected in ways that they haven't connected. Maybe it was just holidays that they were spending with family, but maybe they're getting together now every weekend to have a family connection. There's friends that are reconnecting from across the world with one another. And so there's definitely, and let's even just, we've all had time to slow down.
Wow, that's wonderful. I have a quick story, and that one of my high school friends was a grandchild was facing a high-risk health procedure, and they reached out by text, and within about an hour, we had 25 classmates that I hadn't seen for a long time, sending out prayers and well wishes and staying in touch, and you know, we wouldn't have done that except for what we've begun to learn here with the virus and the changed behavior of how we communicate and our willingness to communicate through other means.
Picking up with what Dr. Penny said, we all love the mountaintop, but life and growth happens in the valley.
Mm-hmm.
And so, you know, the 23rd Psalm, you know, yea, though I walk through the valley of the shadow of death, I will fear no evil, for thou art with me, and thy rod and thy staff comfort me.
Yes,
And so people
Reverend.
love the 23rd Psalm, and we can draw on that and know that in the valley, there is help and growth and strength.
Mm-hmm. Wonderful. Well, we're at our closing hour. I've got a lot of messages that are coming in, thanking each of you for a very informative, very well thought out programs and responses. And I thank you so much. And I can't wait till we get together again and we talk about it and just how we've made it through the winter anyway. What a treat it is to have you all here. And God bless you. And you just have a great day, and we'll talk again soon. Thank you.
Thank you so much. It was our pleasure.
All right, we're going to take a short break here, just a couple of minutes, and then we're going to start up with Jim Hill. We're saying goodbye to Reverend Fair. By the way, thank you for your service and chaplaincy. And Dr. Phillip, Dr. Penny, thank you so much.
Thank you.
Great to have you with us. So you may check out. We'll be back in 2 minutes.
Okay, thank you. God bless.
God bless. I think we're there at our 2 minutes. Well, we're going to get back to it. Healthy, Wealthy, and Wise 2020. I hope you all enjoyed the presentations that we received. It was chock full of information. What do you think, Jim? The panel discussion was chock full of information. Are you live?
Sorry, I was muted. Yep.
Yeah.
It was great. I really enjoyed it.
We have with us Jim Hill. He is the co-chair of the Naperville Senior Task Force. They have a number of things going on we're going to talk about, and then an initiative we'd like to see get up and running here. So welcome, Jim.
Thank you.
Mm-hmm. You want to tell us a little bit about the Senior Task Force?
Sure. We're an all-volunteer group. So the Senior Task Force began in 2014. It was actually started by then Mayor Pradle. And our co-founders were Bev Fryer and Karen Corney. So many of you may know them. Currently, we're a 9-member panel, all volunteers. So there's 9 of us. When we started, we did a lot of listening. Our goal has always been to help the city make Naperville more friendly for seniors. And that means a lot of things. When we started, we did a lot of listening and understood what seniors needed and wanted. And as a result of that, we started a transportation program. It's called Ride Assist Naperville. Karen and Bev were instrumental in that. And what that does is it pairs volunteer drivers with seniors who need a ride, perhaps to medical appointments. We started a newsletter for seniors. You can sign up for that through the City of Naperville's website. We publish it quarterly. We started a program with the Naperville Fire Department to provide CPR training for seniors. So it teaches seniors how to do chest compressions, also teaches seniors how to use an automated external defibrillator, and also teaches how to do CPR on children, because we realize a lot of seniors provide care for their grandchildren and other loved ones. So it teaches that. So that's been a very successful program. That's ongoing with the fire department. More recently, we started a couple of things. One is we partnered with a lot of community leaders in and around Naperville to make Naperville what's called a dementia-friendly community. And this is enables us to join a national network of cities that have committed to providing education and socialization opportunities for dementia patients as well as their caregivers. So we work with the police, the fire, the library, the park districts, the Age Guide, the National Area on Aging Agency, Metropolitan Family Services, and a number of assisted living memory care facilities throughout Naperville. And you can find a lot more information about that on the city's website as well. And then our probably most recent initiative that we started within the last 3 months is something we branded Technology Assist Naperville. And it was sort of born out of the realization that a lot of us have talked about in the last hour about during this period where we're all sort of confined to our homes, but we, the nature of humans is to socialize. And so technology has become even more prevalent in all of our lives as a means of combating isolation and socialization. But then we all realize that sometimes technology either doesn't work like it's supposed to, or we don't know how to use it. Kind of reminds me of a joke I just read this morning of Grandpa and his granddaughter enjoying a breakfast together, and Grandpa says to his granddaughter, "Say, could you hand me the newspaper?" And she says, "Oh, Grandpa, newspapers are so old school. Nobody does that anymore. Here, use my iPad." So Grandpa takes the iPad and he goes in the other room for a few minutes, and he comes back and he hands it back to his granddaughter, and it's all banged up and the screen's cracked, and she gives him that kind of a quizzical look, and he says, "Thank you, that fly never knew what hit him." So sometimes we don't actually know what we're using the technology for or how to use it. And there's other ways to get help, but sometimes it just helps to have a person to talk to. So that's how we got the idea of Technology Assist Naperville, which is simply, again, pairing up volunteers that have some knowledge of technology, how to use computers and iPads and other things with seniors who might need some assistance. So we've had clients, for example, one woman, her kids who all live out of state gave her an iPad for Christmas. That's great, but they didn't have time to teach her how to use it, and she really didn't know how to use it. So we taught her, a couple of lessons, how to do some basic things. We've helped people who are just simply having computer problems. My video camera's not working. Where do I find it? When I do Zoom, nobody can see me. So we've helped solve that kind of problems. What's been kind of a little bit surprising to me in doing all of this is how many people need help with their cable TV. Which remote do I use? And when I put in a DVD, no sound comes out. But the other thing that's really been kind of gratifying is we've helped several seniors who kind of like me. Actually, I'm one of them as well. My cable bill just kept. I was a victim of what the industry puns call cable bill creep. Every few months, it's going to go up $10, and this we've added this, and my cable bill was getting just over a couple $100 a month. But I had another senior who one of our volunteers worked with and helped her actually cut the cord, if you will. And because same thing, she was paying a lot of money, getting a lot of channels that she didn't really use, and so we helped her convert really to just internet streaming. But she could still get local TV, she could still get Netflix. That's kind of what she used, and her cable bill, she cut it in half. She went from a couple $100 a month to less than $100 a month, and we've had a couple of other situations like that where we've helped people, really lower their costs by helping them adopt, some different technology services that gets them what they need, but at a much lower cost. So that's been really gratifying. And again, I think Brian's going to send out some more information after the webinar, but you can always if you look on the City of Naperville website, just type in Senior Task Force. You'll find lots of information about this program, other programs, how to sign up for our newsletter. You find out more about Dementia Friendly Naperville. You find out more about Ride Assist Naperville. So we've tried to put all that in one place and make it accessible for seniors. And then the other thing that Brian and I have been working on is we're doing, Triad is sponsoring that, and the senior task force is participating as well, is really a weekly get together of group of seniors and others. Really just, it's sort of a combination of information sharing, question and answers, socialization, trivia games, things of that nature. But we find that a lot of us really need, because again we're all at home most of the day. We need an opportunity to socialize, and that's kind of what this is providing. And we'd like to invite all of you, everybody who's listening to us today, to join us. And Brian, I assume you'll send out some information about
Sure.
who to contact and how to do that. But it's pretty simple. We'll just send you a link for a Zoom. Everybody's learning how to use Zoom. And if you need some help with Zoom, you can get in touch with Technology Assist Naperville, and we'll get you started on Zoom. But if you know how to use Zoom, then it's pretty simple. We'll just send you a link, and you click, and you can join us for some lively conversation and information sharing, and maybe make some new friends along the way.
Absolutely, and I think it's a wonderful program. Jim and I are actually in that group together, and we formed the groups because we were reaching out to seniors, and we wanted to know what life was like during the early part of the pandemic, and what they were feeling, what their needs were, trying to learn more about them. And we had a grand time together talking, and we stayed together, and we've been together now for a couple of months.
Yeah. It's really
and we are enjoying it. And so the thought is that through the next few months and through the holidays and into the winter, this might be a great model for us to stay together, make some new friends, avoid further isolation if isolation is part of life. And so we are going to send out an invite to all of you using the emails that you registered with and asking if you'd be interested. We do have a couple of things we'd like to ask about. We're looking at potentially using geography as a sort, but maybe there are some hobbies, some common interests. So we're going to try and find out information about that so we could pool those that have that common interest. And this is something that we really think could be beneficial because of our experience and enjoying it so much. We do play trivia in our group, but there could be other ways of enjoying your time together. But we do spend time staying in touch. What's going on? What's the next week look like? So really, I think this would be beneficial to all. So you can look for that in the mail. Email, and some more information about the Triad, more information about the senior task force and some of the things going on. We promise not to misuse this email, but it'll all be directed to helpful information that we think you can apply to your everyday life. So glad to have everyone here. Our next step, or Jim, do you have anything else you'd like to add? And otherwise, we're ready to move to the raffle.
No, I don't, but thank you all.
Thank you. Hey, one of the things before I go, October 2nd, Triad is sponsoring a parking lot bingo, and that is in the parking lot of the VFW on Jackson. Our website has more information. You'll also receive an update. Later in October, we're going to be sponsoring a Medicare update, so we're going to keep you posted on that. In November, we're going to talk about the essential documents that seniors, all of us, should maintain, quite honestly, and how to refresh them as they grow out of date, quite honestly. And then in December, we're going to have a presentation on the 12 scams of Christmas from our police partners. And I'm sure we'll have something fun to add as part of that Christmas holiday program. So those are upcoming things. Really appreciate everyone being here for our 7th anniversary, Healthy, Wealthy, and Wise. It's been a delight. We'll look for the survey. Please fill that out. And we'll see you at, Parking Lot Bingo, October 2nd. Thank you all.